If you've been noticing little skin-colored or yellowy bumps, particularly noticeable in your forehead, your cheeks, or your nose, then you could be experiencing sebaceous hyperplasia. Sebaceous hyperplasia is essentially an overgrowth of the normal oil-producing glands in our skin. So the good news is that it is completely harmless and benign. The slightly annoying news is that they don't really go away on their own. Once you have established sebaceous hyperplasia lesions that are quite visibly bumpy and protruding, and they bother you enough to warrant removal, then we'd be looking at in-clinic procedures. That could involve something like electrocautery using a device called a bifurcator, which is what we use here, or removal using laser. These procedures burn away the bump in a very controlled way, essentially destroying that enlarged gland and causing it to shrink up, therefore becoming less visible and bumpy. The problem with sebaceous hyperplasia is that it is a recurrent condition or a chronic condition, because essentially it's just an overgrowth of a very normal part of our skin structure. I always warn patients that even if you've had your sebaceous hyperplasia treated before, chances are in a few years you're probably going to need another session of treatment. For removal, your sebaceous hyperplasia needs to be seen and examined by a doctor or surgeon who's experienced in treating and diagnosing skin lesions so that we can be sure that they look absolutely fine under magnification before we remove them.